I mean, you've had 24 deaths in your state.
You know, it's a very challenging time, and I want to, every time I talk about this, we talk about numbers, but I just want to remind everyone, these are families, people we know and love, and our thoughts are really with those families of people who've gotten this virus, who are sick, but also with our frontline healthcare workers. If I were to say anything to any of the mayors I've talked to, it's you've got to pay attention to a couple things. Number one, get your healthcare system ready and have resiliency planning, because if you have one event that takes healthcare workers out or your first responders out, it can have cascading events. Test, test, test. We have been so hampered by the early errors around testing in our state that we did not see the spread of this disease, and now we're dealing with that. It's going to be some tough times, but I want to say we will get through this. It will be hard. We are going to have to take some significant steps as a society, but our country is strong, and Seattle and the region is very strong.
But why, Mayor? Why the testing failures?
You know, it was a combination of things. I think that the CDC both limited who could be tested and didn't have enough test kits.
Why?
And so, you know, there's a system that failed, frankly, and we are now at a point where it's becoming more available. We still don't have enough. But across the nation, I would really urge every leader, make sure you're very close to your public health officials. Make sure you have that ability to do broad-scale testing and surveillance. We, fortunately, in Seattle, have some of the best medical researchers literally on the planet. And so we've turned to them. They've actually gotten the genome for the virus already. And through some of their modeling, we've seen that the spread of this in our community is probably much beyond what we think it is. And so we're taking steps accordingly, working really closely together. I think it's really important that people know that their leaders, their governor, their county executives, their mayor, their public health officials, we are going to speak with one voice and have one strategy. This is going to be a tough time, not just in Seattle and this region, but across this country. And so if we really rely on those healthcare professionals to guide us and take steps, I think that we will be able to slow the spread of this virus, but it still will be a major event here in our region.
Okay. Then, doctor, explain this, because I still don't understand the slowdown. The New York Times details this morning that the CDC says approximately 8,500 specimens have been taken since the beginning of the outbreak. Let's compare that to South Korea, which discovered their first case right around the same time. They've got the capacity to test 10,000 people a day. Help me understand this disconnect.
Well, this is partly the reflection of budget cuts that date back to the recession of 2008. So since 2008, about 25% of the public health workforce in this country has been laid off. That's about 60,000 some people. So when you're understaffed, it doesn't matter how good the scientists at the CDC are. They are top-notch scientists, and they're working very hard, but mistakes get made. And that's essentially what happened with the early test that was produced by the CDC, is there were problems with that test. And so they had to, take it back and say, well, we need to make some adjustments here. And that led to some real delays.
Well, what does that say about the United States of America, that we can't handle what South Korea can?
I think it has to do with what we emphasize in terms of health. We emphasize individual health care, not public health. And infectious disease outbreaks like this one are a great example of why some things really do need to be handled at a social, societal level. And that's what public health is all about. But public health in this country has really been underfunded, underprioritized for a very long time.
Mayor, Governor Jay Inslee issued a ban on large gatherings. Tell us what that does to a city like yours. It takes a lot of political will to make a call like that.
It does, and the governor will be announcing a series of measures today. And again, it goes to that one government thing. This virus doesn't respect city lines, state lines, county lines. And so we have to speak with one voice, and we have to rely on our public health and healthcare scientists. And there's no question about it that the measures we're going to be taking in the next 30, 60, 90 days, however long it takes to get through this, are going to have a significant economic impact. And we as policymakers have been trying to do two things. On the public health side, we want to take all the steps we can to limit the spread of this virus and to take care of the most vulnerable.
But what do
on the economic side, side, we have to do the same thing.
How? Because we're speaking to small business owners here in New York who have said they're more worried about going out of business, not having a paycheck, than they are getting the virus. How do you balance the two?
So we're doing a series of things. Yesterday we rolled out a package for our small businesses and employees. For example, Amazon, because they decided to telecommute, many of their employees did not come into the city, and the small businesses around that campus started to have significant problems. They stood up a fund of $5 million to help those businesses weather the storm. We as government are taking a range of things to abate their taxes, to help them with rent, to see if we can make sure that there's no utility shut off for residents or businesses. We're also looking at ways to make sure that there's resilience in the system for the employees. So the governor is extending the insurance that you can get, unemployment insurance. And then for our gig economy workers, we're really trying to come up with things for those people that don't have a regular job or sick time or a regular paycheck. We've got to come up with strategies. And so the city is relying on the federal government, the state government, and us to work together to really try to help those that are most economically vulnerable in this time.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.